Good morning, and thank you all for joining us today for this webinar. We're just going to give folks a couple more minutes to join us, and then we're going to get started and share about the amazing Youth Regional Behavioral Health Navigator program. Again, thank you, and we'll be getting started very shortly. Well, good morning, everyone, and thank you so much for joining us today. My name is Ashley Mangum, and I serve as the Director of Kids Mental Health Pierce County, and I will be facilitating today's webinar. We are so excited to have you here today to learn more about the Youth Regional Behavioral Health Navigator programs and hear from each of our regions who have implemented this program into their communities to really hear about how they have been able to make this unique to their community, some of their initial outcomes, and just the progress of their work. So we are very excited to be here today to share this information. A second goal for today is really to provide a form of community. I know this is in webinar format and we can't see all your faces. So if you could please use that chat box to introduce yourself and let us know who's here, that will be really, really helpful for us. Even though this is in a virtual capacity, we want to make sure that we make this as interactive as possible. We were able to see any questions that were asked when you register today, but you can also use that Q&A button at the bottom to ask any questions during our panel today. We will do our best to answer all of your questions, and if we can't get to them, we will make sure that we follow up after today's webinar. Because we have such limited time, I will ask that if you have case-specific questions, that you submit your questions via email and we can forward them to a panelist or we can follow up to assist with your specific needs. I also do want to mention that today's meeting is being recorded. So if you are having to leave early or not able to catch this live webinar, we'll be able to post this on our website so that you're able to access this at a later time. So with that, I'm going to turn it over to Gina Cavanaugh, who's going to open it up with a land acknowledgement this morning.
Thanks, Ashley. I really appreciate it. So before we start our meeting today, we acknowledge that we are speaking to you from Tacoma, Washington. These lands were shared by the tribes we know today as the Cayuse tribe, the Umatilla tribe, the Walla Walla tribe, and the Puyallup tribe, along with other speakers of the Lushootseed language. I honor and thank their ancestors and leaders who have been stewards of these lands and waters since time immemorial, and we commit to honoring this space. We strengthen that commitment by building relationships based on trust, consistency, and accountability with marginalized individuals and or groups of people while building resources for those in need. So with that, Ashley, I would love to kick it back to you for some opening remarks.
Thank you so much, Gina. And I did see in the Q&A, it appears that the chat has been disabled for this. We will do our best to, actually, I think I could change that right now. I think it's been updated to be able to utilize it. If not, we'll work on that on the back end to see if we can. Otherwise, please continue to use that Q&A box during this webinar today for any questions that you may have. So again, I just wanted to thank everyone for joining us today. As I mentioned before, my name is Ashley Mangum, and I'm the Director of Kids Mental Health Pierce County. And as many of you know, we have been having increasing needs within our communities for behavioral health needs for kids and families. And I know our journey started in Pierce County really in 2018 when we had a significant presentation in our community that really required a coordinated cross systems response. And I think at that time for us, it really highlighted the silos and the challenges that everyone was working towards the same thing, but going in different directions. And we as a community said, how can we come together in a way to help streamline this where families aren't having to go to different forums, where we're not duplicating efforts, and we're able to work in a better coordinated and streamlined way. And we were able to facilitate that in our community by bringing together our first ever Children's Mental Health Summit in 2019 and formed a coalition, which is now known as Kids Mental Health Pierce County. And thinking about timing, I'm so grateful for the implementation of that and us recognizing these challenges weren't going to go away if we weren't going to be able to come together, because little did we know the next year we'd be in a global pandemic that would have a huge impact on all of our systems. And then in 2021, our governor signed a proclamation acknowledging the children and youth mental health crisis that was happening across Washington state. From that, we were able to engage in some statewide conversations to really talk about some of the strategies that we have implemented in Pierce County, or really that included community. We really found that it was so important to bring community into that care continuum to really talk about what are all of our resources and how do we put those resources together to create a stronger safety net for all of our kids. And that really is the foundation of this program. We all have systems limitations, we all have systems resources. And how do we put those all together where we all have a seat at the table to have conversations, knowing that these are all of our kids? A kid shouldn't have to enter to the hospital for them to be able to get those resources. And that's really what we're trying to create through this regional program, is really bringing your communities to the tables to talk about what is needed. What are our strengths? What are our needs? And how can we work as a community to identify things that we can all agree on, that all of our kids need, and how do we work together in those? So you're going to hear from some of our regions today about how they've been able to personalize that format to their region. I really want to thank our partners at Healthcare Authority that have really allowed each region to make this personal, to make this unique to their own regions, to not create some of those barriers that historically we've had to be able to stand up these programs, but to really say, this is your community, these are your kids. How can we again come together to support kids to make sure that they have the right services at the right time and as close to home as possible? And again, that it really is the value and the concept that drives this program. And again, I'm really, really excited for you to hear more about the work from the individual regions and what we're doing at the state level as well. So with that being said, I'm going to turn it over to Gina Cabadoo, who is the program coordinator for the Youth Regional Navigator program, who's going to give us a little bit more information about the program.
Thanks, Ashley. And I think there's a couple of pieces that I really just wanted to highlight about like how this model is bringing the community to the table, how it's making it relevant, customized to the regions that all of you are in, because this truly is going to be a statewide program with a local feel. And there's a couple of components that every region is implementing, but they each have their own spin, their own flair, and you'll hear from them in a little bit about what that looks like. So there's a couple of key components, but what I think is really powerful is that some of it is clinical when we talk about youth behavioral health, but a lot of it's not. A lot of it really comes down to relationships. So one of the aspects that all of these regions are working on using to mobilize the community is having a regionalized website. So we'll be showing that in a little bit. Every region has a website that shows all of their resources, has local contact information for how to get a hold of your behavioral health navigator teams, and it shows the different types of resources that are available, because we know it looks different in every community. We know how people access it looks different in every community, and that there's just going to be a diverse means of how families want to access these resources. So that's one of those things. A second thing that each of these regions has steering and action committees. So it really is literally bringing a community to a table, whether that's in a virtual space or if it's in a physical space, to make sure that you've got different representatives from all the different systems and providers within a community coming together to have those conversations, like Ashley said, about like, what are the challenges, what are the resources, what can we do? A third component is what we call MDTs. Those those are multidisciplinary teams. And that's when you bring the different providers and groups around a table. Virtual is usually how it comes. And you talk with the family, you center the family and the youth in this meeting, and you talk about what are the challenges, what are the resources, and you have those live connections of making sure that whatever it is that the family needs and whatever resources are available, that that person is on the call and that there can be that warm handoff to make sure that there is that connection that's being made and those relationships are being built. So those are really important. And then every region also has a team of 3 of youth behavioral health navigators where they're forging these relationships, bringing the community in, and helping families and community directly get connected towards the resources that are in this community. So I think that's one of the big pieces is, again, sometimes it's clinical, sometimes it's not clinical. I think another piece that is also important is not only is this going to be a statewide model that is happening with a local feel, there's also some data that we're gathering through this. We're working really closely with each of the regions that we have currently on board to collect some measurements so that we can really tell the story of what does access to behavioral health look like in our communities and across the state. So some of those pieces are quantitative and some of those are qualitative. So for those multidisciplinary teams that we talked about, we are tracking like how many are happening, who participates, what are the recommendations that come from that. There's some survey data that each of the regions is pushing out to the families that participate to say like, what was this experience like for you? How are you accessing services? What else can we do to help? There's also some tracking of how many community outreach events are we doing. We can only share about this program and find out who our partners are and who's doing the work by being out and about. So there's some world tours that are happening, as our friends in Greater Columbia like to say. But I think one of the things that's consistent is when families reach out to these youth behavioral health navigator teams to find localized resources, we have parents that literally come to these spaces and they end up crying and they say that they've never expected this many people to show up for them and their children. So that's a little bit of some of the high level overview of what it looks like in each of the regions, but I'll let the specifics be turned back over to our partners. So Ashley, I will turn it back to you.
Thank you so much, Gina. And I did see a couple questions in the chart, and I want to just go back to this slide. And so this program is being implemented statewide. So as it stands now, originally we are looking at implementing 3 regions per year. So in fiscal year 2023, we added Greater Columbia, Southwest, and Salish region, which you are going to hear from today. And that was in addition to sustaining the model that we had in Pierce County through Kids Mental Health Pierce County. We are also going to be adding 4 additional regions in 2024, which is going to include Spokane, Great Rivers, Thurston Mason, and North Central. So if you could see this map, what we're anticipating by next year, having most of this program implemented statewide. But the highlighted regions are current regions that were implemented in 2023, and we're looking forward to implementing those 4 additional regions in 2024. So thank you for that question. So with that, again, this is a collaborative partnership between Kids Mental Health Pierce County, Developmental Disabilities Administration, and Healthcare Authority. And so I did see a question that came in the chat that asked me to say those regions again more slowly. So the current implemented regions are the highlighted regions on your screen. It's Salish, Pierce, Southwest, and Greater Columbia. We do anticipate adding 4 additional regions during fiscal year 2024, and those would include Spokane, North Central, Great Rivers, and Thurston Mason. And if there's any other questions, please feel free to utilize that Q&A and chat box. So at this time, I'm going to turn it over to our partners at Developmental Disabilities Administration to talk about their role in their partnership in this program. And I'm going to turn it over to the amazing Jennifer Forrest to share that information with us today.
All right. Thank you, Ashley. Good morning, everybody. My name is Jenny Forrest, and I am the Youth and Community Systems Program Manager in the Short-Term and Residential Services Unit at DDA. DDA is excited to be working in partnership with the Healthcare Authority, the regional BHASOs, and Kids Mental Health Pierce County as we stand up the statewide Youth Behavioral Health Navigator teams. DDA will support at the headquarters and regional levels to ensure coordination and education of staff to create seamless, skilled cross-system supports. We have recently hired the DDA headquarters Youth Behavioral Health Navigator Program Manager, and Megan Hopkins will begin her role on June 1st. She comes to us directly from the education system and brings a patchwork of relevant experience that will make her a perfect fit for this newly created role. As Megan steps into her role, her work will ensure consistent implementation across the state of the Youth Behavioral Health Navigation Program, create DDA policies informed by the framework already developed by Kids Mental Health Pierce County and the BHASOs, and revise WACs as needed. We know that DDA supports and services are most effective when paired with needed behavioral health services. And there continues to be support and focus from DDA executive management on the timely assessment and discharge from acute care hospitals and other institutional settings to DDA services. The Youth Behavioral Health Navigator Headquarters Program Manager will work with regional staff and stakeholders to identify and address gaps in the availability of behavioral health services that are barriers to timely discharge and transitions to lower levels of care. This program will support the goal of all the project partners, which is to get the right services and supports to the right youth at the right time and in the right place. And that's what I have to share with you all today.
Thank you so much, Jenny. We're super excited about this partnership and all the collaboration that's already happened with DDA's participation in the multidisciplinary team meetings and just being available to consult. It's such a different feeling to not have to view it as a system, but have a relationship and a contact that you could just reach out directly to someone if you have a question, if you have a barrier to support the youth that we're working with. So we're super excited for Megan coming on and really appreciate your collaboration as we implement these programs statewide. So thank you.
Yes, we're happy to be at the table.
Absolutely. All right. So next we're going to hear from our current regions who have implemented the Youth Regional Behavioral Health Navigator programs, to just hear about their unique experience, and hopefully you'll be able to connect. If you're in one of these communities that these programs are already implemented and you're not connected with this work, we'll be sharing their contact information, hopefully for you to be able to get connected as well. So first, we are going to hear from our partners in the Southwest region. And I believe we have Charity Joy here to talk about the amazing work that is happening in the Southwest region.
Good morning, everyone. I'm Charity Joy, and I represent the Southwest region, which is Klickitat, Skamania, and Clark County. And I'm one of two outreach care specialists that works directly with the families. And Ashley, do you mind going to the next slide? Do you have it? Okay. I'm going to read off this. So Brooke Vejo is our program manager, and Taylor Peterson is the other youth specialist, but they're at another meeting. But currently right now, we have had 32 requests actually for MDTs and 5 in the last 4 days. So we're really busy. And we've had 12 MDTs. We've held 12 MDTs since March 1st. The people who attend are the MCOs, DDA, schools, crisis teams, juvenile court, emergency departments, and youth serving agencies, among others. Our steering and action committees, we have 2 broken down by counties. Klickitat and Skamania, we have a separate committee for them because that was what they requested. And they have a lot more, they need more services. And then one of our committees are in Clark County. And actually today, my team is meeting with that committee today to get the cadences on that. So The cadence of our stirring and action committees, we talk about the current stats, questions and concerns since we've been doing the MDTs, and then feedback. And we talk about goals and action steps. And today is our first one with Clark County, so we will get the feedback from that one. We had the one for Klickitat County a couple weeks ago, and we got some really good feedback from them. Any questions?
Thank you. And again, please utilize that Q&A box if you guys do have any questions. And in Charity, I just want to say it's been, again, amazing to watch you implement this. When we first started working with the different regions coming from Pierce, and I saw that regional map that we all just looked at, and I saw regions had multiple counties, I got so nervous thinking about how are we going to create something like this in a region that has so many different counties. And so to see all of you regions that have multiple counties do this with such intention and bringing to these communities and knowing, getting to know your communities in a way to be able to respond to their unique needs has been amazing to watch, and really shows that this can be implemented in each community that we have with intentionality and bringing the right partners to the table. So I just want to congratulate you to have 30 referrals. Again, says from your community that that's a trusted resource, that's a trusted forum, and that you guys are doing some amazing work. So thank you again for sharing that information.
Thank you, Ashley, and thank you, Gina, for all your work.
Of course. So next, I'm going to turn it over to our amazing partners in the Salish region. And I believe we have Brian Gross here to talk to us about the work that they're doing in Salish through the SYNC program.
Good morning, everyone. Thank you, Ashley and Gina, for putting this together and inviting us to be a part of it. So my name is Brian, and I am the SYNC supervisor here in the Salish region. We are a part of the Salish BHASO. SYNC stands for, or SYNC stands for Salish Youth Network Collaborative. And as has already been mentioned, basically, it was developed to serve children and youth experiencing complex behavioral health needs and their families, with priority given to youth in emergency departments or other non-treatment facilities needing additional system support regardless of insurance. I think it's always important to bring out that regardless of insurance, what we offer here, the services and the coordination that we offer, insurance has no bearing on that. So we're really glad for that as well. Currently, I began as the SYNC supervisor in November of 2022, and we have now two new program, well, not, I guess they're not actually new anymore, program coordinators, Danielle Jinkle and Jesse Parson. They both came on in February of 2023. So the three of us have been working to just kind of get to know everyone in the community, making connections, learning about the resources that are already available in Clallam, Jefferson, and Kitsap County. There's already a number of providers here who are doing amazing work. So we are taking every opportunity that we can to learn from them and just kind of pick their brains and see how it is that we can sort of get in the mix with the rest of them and help out in the communities that we are a part of now, and very fortunate to be a part of the Salish region. So a couple things that we have been working on. We have been working on making those connections and community partners, working with the steering committee and recruiting additional members. So anyone here who maybe you live in the Clallam, Jefferson or Kitsap County in the Salish region, if you'd like to be a part of the steering committee, we definitely welcome that. We are also creating a multi-party release of information. And we're working on our process developments to include forms, referrals, and metrics tracking. I want to thank YARP and Kids Mental Health of Pierce County for inviting us to be a part of their MDTs. It was extremely beneficial just to kind of observe and just sort of see what that process looks like. And we walked away from both those meetings with lots of great ideas and how we kind of wanted to implement and what we wanted to, I used the word borrow instead of steal from you and your ideas. So thank you for allowing us to borrow those wonderful ideas. And so we're definitely looking forward to begin taking referrals. We have not started taking referrals as of yet. We are hoping to do that in the very near future, maybe in the next couple of weeks. We are still working on our website. So the website has not launched, but that is where you would be able to go and find a sync request link where you could make a referral for an MDT, find information regarding all the resources that are currently available in Qualam and Jefferson, Kitsap County. Danielle and Jesse both have been working very diligently, putting those resource lists together, making sure they're accurate, making certain that the link that you click on takes you to the information that you may be looking for, as opposed to, most of us have probably been to a website and it's, well, the information we're looking for is buried 10 layers deep. So we're trying to bring that information to the very front so that what you're looking for will be very accessible and easy to find. So they've been working very diligently on that. So we are also listing our monthly newsletter on the website, as well as upcoming trainings. We are reaching out to the providers in the Salish region, and we're just asking them to share with us any events that they may have coming up, so we can put that on our calendar of events, which will be located on our website, just as a way to kind of share the information and kind of keep everyone connected as much as possible. So Salish region has, like I said, a wealth of providers and people who have been working in this field for so many years, and they've had wonderful ideas. So we're learning a great deal from them, and we're continuing to enjoy that growth period for us. We've had an opportunities to be out in the communities. If you haven't had a chance to kind of tour the Salish region, I encourage you to do it. Jesse and Danielle and myself, none of us are actually from Washington, so we have enjoyed getting out and seeing the unbelievably breathtaking postcard-like sceneries up here. And just meeting the individuals in the communities in the Salish region. So taking road trips and enjoying the scenery and meeting people has been a part of our growing process and learning process. But yeah, as we continue to grow, like I said, we will be launching our website in the very near future. We are always open to, input from others, any way that we can learn from those in the community that can just kind of help us to make sure that this program is a strong program and a benefit to the community. Like we saw with Southwest, 30 referrals since March 1st is unbelievable. And that's awesome. It's a great number. We were hoping for the same thing or something similar. So we appreciate, Meredith and Zach and Gordon and Ashley and Gina and everybody else who has just been wonderful in helping us to kind of learn and grow and kind of be a part of the Salish region. So on the screen, you can see our contact information. By all means, feel free to reach out to us. We would love to, learn more from you and share with you what we have learned as well. And we're really excited just to continue to grow Sync here in the Salish region. Thank you guys very much.
Thank you so much, Brian. And that is super exciting. And we know just even hiring is a win. So we are super excited to have your team built and excited to get the website launched and to implement this program. And you had an amazing steering committee meeting, didn't you? Already?
We have had several. We've had two. We've had two steering committees getting ready to have our third one, and it's been amazing. Just the input and the presence of the people that have been there. They've been amazing. So
That's awesome.
Even things that just opening up our eyes to things we hadn't considered, which may seem so silly to some, but one of our members said, "Hey, use that word sync." So we've been using that every chance we get. We're syncing up the community to the resources. So our steering committee has been phenomenal with helping guide us and point us in the right direction. So kudos to our steering committee. They've been wonderful.
That's amazing. And just so everyone on the webinar today knows, we are planning to do another webinar on the fall. So I'm excited to have more updates. I'm sure we'll be able to highlight the website then, Brian, and be able to share additional information. But again, congratulations to your team. We are so happy to partner with you. And Gina and I are dying to come over there. So we will come visit anytime.
You're welcome anytime. And when we do launch the website, we're going to email everyone and their mothers and fathers. So everyone knows that it's launched. We're looking forward to that. But please come visit. We would love to have you guys anytime.
Absolutely. Well, thank you.
Thank you.
All right. So next, we're going to transition to our partners in the greater Columbia region. And I believe I saw Meredith and Zach on the call today. So I'm going to turn it over to you to let us know more about what's happening with YARP in the Greater Columbia region.
Hi, everybody. Zach Roddy. I'm the Youth Navigator for our version of the Youth Access and Resource Program. I'm joined with my colleague, Meredith Pyhowski. She's the care coordinator. Gordon, unfortunately, is out of state at a work conference, so he wasn't able to join us. I think for me personally, one of the most rewarding things off the top would be kind of the collaboration of our steering committee that we started building back in July of 2022. Our program launched in January, but so we had 6 months to meet. We met twice a month up until program launch. And I think that one of the most rewarding things is just the buy-in, because what you're essentially asking these community partners and these system partners to do is, volunteer their time during billable hours, essentially. And so we were very strategic about who we selected, from behavioral health providers to law enforcement, the school district, DCYF, DDA. And so back in July, they helped us form the bones for what we wanted the program to look like. And just to shout out to the Healthcare Authority for the flexibility you are giving each region to kind of tailor the program to best fit the needs of your community. So we've really found great benefit in that. And so some of the priorities that the steering committee helped us establish for year one was increasing and organizing autism and IDD trainings. We have our first with our DDA representative later on in the summer. Community education and collaboration. So YARP has tried to get involved in literally anywhere we can plug our program. Gina mentioned the world tours. It's like any school district, counselors, any agency that would have us, we would go and promote the program, get feedback from community providers and family members for what barriers to accessing mental health care for their kids actually looks like to them. And that's essentially what YARP is trying to tackle, knowing that, after year one, we're going to be able to go back to the Healthcare Authority and say, hey, we found success with this number of referrals. And up until this date, we've had 26 referrals, 7 of which have gone to MDTs, and we've had a number of consultations. And then also understanding we're going to have referrals where it's like coming to the understanding that we lack resources for X in our area. And what can we do about that? So one last goal we have with our steering committee is to have some type of legislative representation to help us have some pull and decision making when it comes to those things. I encourage all of you to check out our website, whether you live in this area or not. We have a resource hub that I think would benefit statewide. The resource hub is, if you're on the homepage, it's in the top right-hand corner under the service availability tab. It highlights, currently we have about 50 providers listed on there, what wait times to anticipate, what insurances they accept, their staffing levels, and that kind of thing. And that's a partnership that YARP made with ESD. That's a hub that's updated every other Friday. So we're super excited about that. In addition, we're also being strategic about, because one thing that's unique about our region is we're so spread out. And so we live in Benton and Franklin County. And so that's where we are starting the program. And then we're having talks internally about how we strategically want to expand that out to the other regions in the Greater Columbia area. Right now, I think we are focused on Walla Walla and Columbia for 2024. And anticipate including Yakima and some of those other smaller regions the following year. And so those talks are still being had, but I also like to turn it over to Meredith for anything that I could be missing there.
Hi, good morning / afternoon almost to everybody. I just want to thank Kids Mental Health Pierce County, Ashley and Gina especially, and everyone we've been collaborating with. It has been when we got Schedule J and we started looking at it and we're just like, man, I don't what are we going to do? But it's really come together and it has taken a village. for sure. And I think that has been kind of, I guess, for us, a really great part of this process. When we first started our steering committee meetings, they were very quiet. And, as they progressed, they started getting louder and people making conversations and discussing programs and really getting that interpersonal connection. And I really hope that is going to continue even more as we include other counties into our region. And I really hope that families will start to feel that collaboration, because I think what's, missing sometimes from mental health services is that follow through, that golden thread. I think that phrase dates me a little bit, but, just finding everyone kind of being on the same page and everyone working towards the same goal, which we all are. Every agency that is in the Tri-Cities, that is in Yakima, that is Walla Walla, we're doing this work because we care about kids and we want the best for them. And I hope that by having these MDTs, that the families will start to really hear that, see that, believe it, and feel it just from the meetings. So that has been a really cool process. I've never really been involved in something quite like that before. So that's been amazing. And we have been really working hard to work on our year one priorities. I mean, that's what also makes this program a bit unique, is that it's not just an MDT. It's not just working with kiddos that have complex behavioral health needs. It's a whole community-wide effort. And so it's really about, what are the gaps in services? What can we do about that? How can we help? How can we brainstorm and maybe come up with different things that maybe we've never thought about before, different perspectives. So that's been a really cool thing about this program and about the community, and really building that community. And I'm really excited to be expanding out. We have, as you could see by the map, we have a 9-county region that is quite expansive. And so it is going to be interesting to get out there and include all of those areas. But I think it's going to do nothing but benefit and increase our collaboration and increase the services we can offer kiddos, even if they have to travel a bit, and increase our knowledge, because every community and every agency has their own perspective and different expertise. And it's just been great kind of finding that. I know if Gordon were here, he would mention that he's been doing mental health work for, I think he says 30 plus years, and he's still learning about different programs that are available. So I think that has been a really cool feature about the Youth Navigator program, is really trying to make those connections. Zach did a great job about talking about what we've done so far, but a couple of the things we've been able to do, and part of having these flexible funding opportunities and unique problem solving ability to solve unique problems, is that, again, there's no, like Brian said, there's no insurance component. We've been able to purchase a bed for a kiddo and a weighted blanket and a weighted stuffy. We've been able to provide a family who has been traveling to many different areas in the state to get assistance for her youth. We've been able to provide her a gift card to cover some of the costs of her travel and her stay, because that has been a big burden for her. And we are also able to cover the cost of a youth camp through that has a special program for youth that are IDD and on the autism spectrum. And so this family that wouldn't ordinarily be able to send their youth to summer camp and get these wonderful skills that I know that they will receive are going to be able to do that this summer. So, we're really trying to also use some of our funding and some of our, kind of the our liberty to kind of do what we think is important for families. And I think that's been a really great part of this program, as well as being able to support families when they need the support and give them the assistance that they deserve, because the kids really do deserve as much help as we can provide them. So like I said, our next step is to just really expand out. We're meeting to strategically do that. And I'm really looking forward to increasing our circle and widening our circle. And I also want to throw a shout out to Mark, who's been phenomenal with our website. The website part is kind of my baby, and the hub is kind of Zach's baby. So I don't know if we have twins or what's happening, but we've really been working hard to make a website that is user-friendly, that provides good information, that's kept up to date. I really like the idea of a monthly newsletter. I think that's a really cool thing that maybe we will borrow in our region to add along with our calendar of events. But we've been really trying to work hard on our website to make sure people can find what they are looking for and not have to search for a long time. So yeah, it's just been a great experience. Wonderful to get to know all these wonderful people from all over the state of Washington. And yeah, so thank you guys so much. It's been a pleasure.
It has been a pleasure. And I just, again, want to congratulate you and your team. You guys have been doing just such tremendous work. And I also just want to add, I think one of the things that has been so impactful for me is we do have a monthly learning collaborative where we've been able to connect all of the regions together and learn from each other. And I've learned so much from your region. We're like, wait, we want a community calendar. We want this resource hub. And to know, like, even to hear somebody's already doing this, so we don't have to recreate the wheel. Let's partner and get this out on a broader level so that more families can have access to this information. So it's been so helpful to hear, again, what's working in our rural communities, what's working in our schools, and how do we bring all that information together. So I thank you guys so much for being such a tremendous community partner and all the work that you guys are doing. And for you guys both coming up with great acronyms, SYNC and YARP, come on. So great work, team.
Actually, just to piggyback, appreciation for, I'm happy we're able to pay it back a little bit. Launching this program can feel, it felt overwhelming. Pierce County sharing just simple things like policies and procedures, mission statement, just to get the ball rolling was huge for us. So I appreciate you. And Mayor mentioned Mark Stiletti. He's been great, very responsive. So appreciate you guys too.
Of course. Thank you. All right. So next we're going to transition to our Pierce region. And we have program coordinator Vanessa Adams here with us today to share some information about Kids Mental Health Pierce County.
Hi, everyone. I just want to piggyback on what Ashley was saying. I'm so excited to hear from all the folks. I've had the pleasure of working with Meredith, Zach, Brian, Charity, Brooke, who's not here, lots of folks in developing their regional programs. And I have stolen, borrowed, shared, collaborated on many things. And I think that's one of the beauties, some of the richness in these programs and the collaboratives that we have. We all have opportunities to learn from one another. It sounded like Gordon said he's still learning, and I think things evolve. So we always should be learning. So I'm really just excited to continue to learn together. So Ashley and Gina both shared a little bit about the history and kind of what's gone on with Pierce County because we're a little older. But I am new-ish to this team as we have grown and expanded. I had the opportunity of facilitating multidisciplinary team meetings. And for those other region folks that have attended MDTs invited to our team, they really know that it's the relationship. The relationships in Pierce County are the biggest component of making an impact on the community. These are all of our young folks. So Kids Mental Health Pierce County, excuse me, had a steering committee retreat this year where the focus was really looking at where we want to go moving forward, looking at refocusing our priority actions and creating our next steps for where we head in the next 2 years. So our steering committee came together and continued to have those conversations, as some of the other teams have discussed, just getting louder, getting more invested, getting connected in the community, and came to an agreement of the 3 focuses that we'll have, being bolstering our youth mobile crisis, access, wellness, and care coordination, and expanding local and statewide capacity. So really recognizing what we need in our community that might look very different than other communities, but having the flexibility to look at what we need right now, and knowing that that doesn't have to be forever, that we can pivot, we can shift, and we can change direction as we need to. This is fluid, and the needs of our young people are going to be changing and evolving as well. So in doing that, the really exciting component of that is shifting from our action teams that we had to our implementation teams. So working with community partners, providers, school districts, law enforcement, a hospital, in looking at these specific items, these specific components, and seeing how we're going to implement them. In talking about what we share and what we steal and borrow, we really love the idea of having a place, a hub, having Zach's hub, Zach's baby. So maybe we have cousins, I'm not sure. You have twins, we have cousins, but adding that component so that families have a live, up-to-date, really robust service list so that they're not hunting around. We have a really, really rich resource list, but having a live, having up-to-date what insurance, what the waiting list, what that looks like for families. So one of our implementation teams is continuing to work really, really hard on getting that list of providers up to date, ready to go, and have that posted to our website. So we're excited about that as well. And just really looking at how we can continue to expand, to improve our newsletter, to improve our website, to look at what different needs are happening in our community as things change and shift. So those are some of the exciting things that have been going on. We have had the incredible opportunity to have a youth summit for Mental Health Awareness and Acceptance Month with hundreds of young folks and families attending. We've been able to have a youth behavioral health network breakfast where we have brought our providers, our partners together to continue to build those relationships, because I think that we have conversations a lot around barriers, what we don't have, where things are not going well, but we also have such rich communities, so many folks that are really invested in our young people and families and want to do well. As Meredith said, we all have the same goal. We all want to support our kids and families. We all want to come together. So really just seeing the value and the investment that folks have. So we've done several events where we have been able to come together to have these conversations. Sometimes they're challenging, and sometimes we do recognize barriers are there, but continuing to just move forward and work together and connect and have those relationships to build on what we do have. Our MDTs have continued, the requests have continued to come in, continue in Pierce County to do really intensive behavioral health navigation or facilitate multidisciplinary team meetings, with the focus being family first, family centered, specific to the young folks and families and their unique needs in our communities. So a lot of exciting things, and just excited to continue to work with all of the regions and learn and borrow and grow together. So just really excited about where we're heading and the ways that we're growing and collaborating statewide.
Thank you so much, Vanessa, for that update. And I just saw a comment in the chat that said, "I'm so glad that all the counties value mental health and are on the same page. I'm in tears." And it really is that sentiment of community and collaboration. And we hear about systems all the time, but what it really comes down to is community and what we do have and what we can build our relationships, which is often going to be easier than transforming of an entire system. And so again, for us to not land on, we created more beds, or we have this new intensive outpatient. No, we had a conversation We hear parents say, I've never had this many people come together just to hear about what I need for my child. And from this allows us to have advocacy, right? You know, some of the examples in Pierce County that we've been able to do is leverage these forums to advocate for more county funding for youth-specific initiatives. We recently were able to get a behavioral health tax approved in Pierce County. And for the first time ever, there were youth-specific priorities within that, because of the advocacy and the streamlined ability to advocate through Kids Mental Health Pierce County's steering committee and all of our various community partners. And so these are the things that we're able to do when we bring the community into that care continuum. Again, with that message of these are all of our kids, and how do we work together to make sure that they're healthy and well in their homes and in their communities. So I'm going to invite all of our panelists back up into the webinar, and I'm just going to go through some of the questions that were asked during registration, just to be able to answer some of those questions, and then we can also go through some of those chat questions. I do want to say, when we sent this information out, we got a lot of questions about how this may interface with the recent legislation of House Bill 1580. And I think what we would like to just message is that we are watching, we are listening, and we are looking for ways to support this work. There have been no formal conversations within that, but I know in terms of mindfulness, we've had similar conversations of how is this different from CLIP? And so all of the same sentiment is that we want to work collaboratively as partners. We don't want families having to navigate multiple forums and meetings and MDTs. And so we want to work collaboratively. So what I would say is, again, we are watching, we are listening, and we're looking for ways to support this work. And we will make sure to share updates as we know of any impacts that it may have on this program. So I know that during our presentation, all of you talked about some of the things that you guys have been doing within your regions. Can any of you guys just give specific examples of what type of programs or resources have been leveraged to close the gap in the behavioral health system to support youth needs within your regions?
I can speak on, we have multiple, but I can speak on one that really just stands out to me. There was a youth that we had who had been with a managed care organization for a while, but the family kept bumping into walls and not getting the medication for the child that they needed. And so we were able, with the MDT, we were able to get the senior physician over CMAR at the second MDT. So we had one big MDT, and sometimes what we'll do is piggyback off of the first one with a smaller group. So he showed up at the second MDT, and because of his presence and who he is, that child was able to get an appointment within a few days and get his medication, get the medication that he needed because he had been off for a while. So that's just one of the really good things that we like and we see in our MDTs, is just how the community, somebody mentioned it takes a village. And when I'm talking about our MDTs, that's what I say, it takes a village. It's one community coming together for the youth. And that just is what stood out to me. There are so many more examples, but it's really all in who you know. And because we know the right people, these families and youth are able to get the services that they need. So mom was in tears. Even the social worker could not believe how we were able to do that. And then now people are telling us that because we're Carillon, so they're saying your guys' name in the community has clout. So when we mention it, then they get on it. So that's just one of the great things that I've noticed.
Yeah, that's good clout. So that is that is absolutely amazing. Any other of our regions want to give an example?
I think one that YARP has seen several times is, you know, what we found, and we didn't anticipate signing up for this, but we're kind of an accountability partner. Mm-hmm. So when we have these MDTs, and if a particular kiddo has a Medicaid provider, we're inviting that MCO to the MDT.
Yeah.
I think what we found a number of times is families aren't aware of how much an MCO can offer them, from, case management to coordinating what services you are eligible versus what you're not eligible for. And so kind of having that conversation, one of the first, there's a recommendation letter following the MDT with all of these resources that the MDT team recommends. And one of the most common ones is, a referral for case management through the MCO to kind of help provide that follow-up. So that's one we've seen a lot of.
Yeah. And before I move on to the next question, I always like to share this example because I think it really kind of speaks to the sentiment of the multidisciplinary team meetings. But I remember early on in Pierce County days, when I was facilitating the MDTs, we had a young person who literally had cycled through every system in a short amount of time. He would come into the emergency department, he wouldn't meet acuity for inpatient hospitalization. And so behavioral health was kind of like, it's not us. And unfortunately, parents refused to pick him up. And at that time, he ended up in the child welfare system because he had no parent available to assume care for him. And unfortunately, shortly after that, he ended up assaulting somebody and ended up in the juvenile justice system. So this youth had literally cycled between behavioral health, child welfare, and the juvenile justice system in a very short amount of time. We were able to convene a community multidisciplinary team meeting, and we're able to bring in the schools to that meeting. And during that time, we had just transitioned to at-home learning. The pandemic was happening. And what we learned from that MDT was that kid was really struggling with not having in-person learning. That school was able to advocate for that young person to come to school and have some in-person time. And we have not seen that youth since then. And that would be not something that I could recommend as a clinician. I wouldn't have even been aware that that would have been an option, but bringing his community into the conversation, a resource and an intervention was able to be located and identified for this kid that made the difference. And that's what these MDTs are able to do for these kids. And so that transitions perfectly into our next question of how have the schools been integrated into this effort in each of your regions? Whether it be your steering committees or MDTs, how are you working with the school districts?
In Pierce County, we have a history of really rich collaboration with multiple school districts. So on our steering committee, we have 2 different school districts represented in our steering committee. And on our implementation team, we have our folks from our ESD. We have multiple folks from additional school districts, those two largest school districts, but then also 3 other school districts participate in our implementation teams. We do presentations all the time. I'm constantly in the community. I heard a road trip or, doing the road trip out in the community. So going there, so really inviting them in, but also going to them. So kind of goes both ways in Pierce County and our community, really close collaborating.
And in our region, we have all 3 school districts represented on either steering committee, action team, MDT, or all 3. They've always been very good about supporting us and supporting the youth and trying to brainstorm. We also been really working closely with ESD 123, who has been the ones partnering with Zach on creating and refining the resource hub. In fact, it was they were doing it on their own, and then we kind of made that a collaboration, and that has been really, really wonderful for us and for the community. So we've just had a lot of good support. And I think the school staff, when they don't know where to turn or they don't know what other resources they can access, we've gotten a lot of referrals from the school, a lot of even just calling us up and saying, hey, is this an appropriate YARP referral? Like, should we, how can we, get assistance with X, Y, and Z? And we're able to help them kind of work through that and maybe make some suggestions. So it's not necessarily going to an MDT. It's just like, hey, what's their insurance? Try this and try this. And so that's been a really big help to us. And I think as we expand out into other school districts, I think it'll continue to be very collaborative for us.
Thank you. And I know we are nearing the end of our time together. And again, we will answer questions that came up in the chat that we're not able to answer. And we do plan to have another webinar later this fall where we can have additional information to share with our joining regions. But I just want to end, and maybe we can go around again. This last question was, how can community partners such as school, child welfare, and other community system partners best connect with navigation teams? So I know that we shared that information on the slide, but if we can maybe start with the Southwest region of just answering what would be the best way for partners to connect if they're interested in collaborating in this work?
The best way for us would be going to our website. Actually, just contacting, if you go back to the slide, our emails are on there. And what we do when you send us an email, we will contact you. And then we just set up a time, whether it's a Zoom call or meeting in person. And that really is the best way you can partner with us, is just setting up a time. We'll come to you or we can Zoom.
Thank you. Salish region.
Yeah, here in the Salish region, I agree with Charity. It's pretty much the same way for us as well. Even though we haven't launched on that one the one slide, there's our phone numbers, our emails, and give us a call, shoot us an email, and we're happy to have a conversation over the phone, come to you in person, have a Zoom meeting, come to your house for dinner if you'd like. However we can make ourselves accessible to the community is what we're wanting to do. So same for us.
Greater Columbia.
Yeah, for us, it's either the website or yarp@gcbh.org gets shot to our entire team. yarp@gcbh.org. There's something you wanted to staff. We encourage folks before if they're uncertain if it's an appropriate referral, to give us a call or email us, and we can break it down.
Thank you. Pierce.
I would say the same way. I'm always happy to receive emails. I think that so with Argina and Ashley, go to our website. You can ask to join, send an email through there, but also just directly to me, to vanessa.adams@multicare.org. And I'm always happy to come in person, share a meal, share a conversation, connect, because the core of all of this is relationships. And what better way to do that than over a meal? Really grateful to our community for all the ways they reach out.
Thank you. Well, thank you all so much for joining us today. We know it was a lot of information in a short amount of time. We are happy to come out to your organizations or meet individually, share more information. Our contact information is on the screen. There is a QR code that will link you to the Kids Mental Health Washington page, which is the statewide hub where you'll be able to connect to all of the regional websites to be connected in your community. So again, I want to thank Healthcare Authority. I want to thank our partners at Developmental Disabilities Administration and all of our regional partners. I thank you for being brave and taking this work on and making it your own. And taking that to your community. So again, thank you all for joining. We will record this and share the materials, and we look forward to continuing to partner as we work as a state to get kids the right service at the right time and as close to home as possible. So thank you.